Welcome to Module 11. In this section of the course, we're going to discuss confidentiality, disclosure, and ethical responsibilities that are related to HIV in counseling and behavioral health settings. So for a lot of people, concerns about privacy and disclosure, those are going to be among the most emotionally stressful aspects of HIV-related care because the clients are going to fear rejection, discrimination, gossip, relationship conflict, job loss, social isolation, and judgment from other people. And because of this, confidentiality is really important. Counselors are going to play a major role in creating emotionally safe environments where our clients are going to feel protected and respected and, treated professionally. So in this module, we're going to focus on the importance of confidentiality and ethical responsibilities in counseling relationships, disclosure concerns that the clients may experience, maintaining professional boundaries, and also how counselors can respond appropriately to sensitive information. And it's important to remember that HIV-related discussions are often going to bring about strong emotions. They're going to bring up fear and vulnerability in the client, and the client may hesitate to share important information if they are uncertain whether or not they can trust the counselor or the treatment environment. So the goal of this module is not to turn you into a legal expert, but it's just to strengthen your awareness of ethical practice and respectful communication and professionalism when we handle highly sensitive information. So confidentiality is one of the foundations of effective counseling relationships. Our clients are more likely to speak honestly when they believe that the information is going to be handled respectfully and appropriately. And that's why it's important when we discuss highly sensitive issues like HIV or sexual behavior, substance use, trauma, medical concerns, relationships, all that. And that fear of exposure or judgment is going to cause the client to withhold their information or minimize their behaviors or even avoid health care. And they might even disengage from treatment entirely if they don't feel like they can trust us. Because a lot of people living with HIV, they experience discrimination or stigma in the past. And because of that, the treatment may already feel like it's fragile. So counselors need to recognize that even small breaches of confidentiality can have a very significant emotional consequence. And our clients are really going to pay attention to how we speak about other clients or how private information is handled and whether our staff appear professional or respectful. And we know that confidentiality is not just simply a legal requirement, it's also a major component of emotional safety and ethical care. And a lot of people experience fear surrounding HIV disclosure because they're going to worry about losing their relationships or being rejected or becoming socially isolated. And then, of course, they face discrimination or being treated differently. And, maybe they've experienced negative reactions about disclosure in the past. And so that makes the future disclosures feel really emotionally dangerous. And other people may feel trapped between wanting support and fearing exposure. That disclosure can affect their romantic relationships, their family dynamics, their friendships, their employment, their healthcare interactions. And so our clients are going to ask us for advice about whether they should or shouldn't disclose their status in certain situations. And we, as clinicians, should avoid giving overly simplistic answers because disclosure decisions, they're going to involve really complex emotional, legal, and relational and safety considerations. So instead, what we need to focus on for our clients is to explore their fears and process their emotions. We want to help them to consider what are the consequences of this and also have them access appropriate support and medical guidance when that's needed. Professional counseling is going to help our clients to think through situations thoughtfully rather than just making the decisions for them. So we do have an ethical responsibility that extends beyond simply just keeping information private. Ethical care also is going to include treating our clients with dignity and avoiding any discriminatory behavior. We want to maintain professionalism and create an emotionally safe treatment environment. So we need to avoid gossiping or judgmental comments. Make sure that we're not unnecessarily disclosing any information or discussing clients just casually outside of appropriate professional settings. Even subtle reactions can affect the client significantly, like if I suddenly appear uncomfortable or start avoiding eye contact or using stigmatizing language. Basically, if my behavior changes after learning a client's HIV status, that can communicate judgment, even if it's unintentional. And our clients notice these responses immediately. So ethical counseling requires self-awareness and professionalism and consistent respect for client humanity. And it's also important for counselors to recognize personal biases or discomfort that they may, they're influencing the interactions. Professional ethics requires counselors to manage personal reactions appropriately rather than allowing these reactions to affect client care. And as clinicians, we have to have a general understanding of healthcare privacy protections, including HIPAA requirements in applicable settings. So HIPAA refers to laws that are designed to protect the sensitive health information from unauthorized disclosure. Our clients often assume that, highly personal information is going to remain confidential, and we have to take that responsibility seriously. So we have to protect their written records, secure any electronic documentation. We want to avoid casual conversations about our clients, and we want to limit disclosure to unauthorized professional purposes. To authorized professional purposes. So, an unintentional disclosure can damage the trust significantly. So problematic behavior might be discussing clients where other people can overhear, leaving records unsecured, sharing unnecessary personal details with people who aren't directly involved with their care. We don't have to become legal experts, but understanding the importance of privacy protection is really essential for us, because our professionalism includes treating that client information with seriousness and care. And although confidentiality is extremely important, we should understand that there are situations where confidentiality has legal or ethical limits. And depending on the state laws, workplace policies, and professional roles, we may be required to report certain situations about abuse, neglect, imminent danger, serious safety concerns, etc. And the clients need to understand these limits as part of informed consent, and we have to do that in the orientation process at the very beginning. When we discuss the limits of confidentiality, we have to communicate calmly and clearly, rather than, in a threatening or intimidating way. And it's important that the client understands what information is protected and what situations may require disclosure and why those policies exist. We want to avoid making promises about absolute secrecy that can't be legally or ethically maintained. And then at the same time, we also need to explain the limits of confidentiality, and we need to know that they shouldn't be used in a way to create unnecessary fear or discourage openness. Professional balance is important. And some people who live with HIV or engage in high-risk behaviors have experienced some discrimination in healthcare systems, like judgmental treatment, dismissive attitudes, breaches of privacy, refusal of care, disrespectful communication. The list can go on and on. And so as a result, people develop distrust towards our healthcare systems. And so that may lead them to avoid getting tested or delaying their treatment, or minimizing their symptoms. Or they could just disengage from healthcare entirely. And so we have to recognize that fear and the mistrust. And we know that it often comes from very real experiences rather than just an irrational paranoia. And so trauma-informed care is going to acknowledge these concerns respectfully while helping the clients access safe and supportive services whenever possible. So the counseling relationship is going to be an important corrective emotional experience that the clients can feel respected and heard. We have to remain aware of the professional boundaries and the scope of practice when we discuss HIV-related concerns, and we have to provide or avoid providing advice outside of our training and authority. So we can provide emotional support and encourage healthcare engagement and assist with referrals and help clients process emotions and decision making, but we have to maintain professional boundaries. And then, avoid becoming emotionally reactive or overly involved in our clients' personal disclosure decisions. Support exploring and informed thinking rather than controlling the client's choices. And we have to recognize when collaboration and medical providers are necessary, case managers, other professionals, when that's appropriate. Our clients are more likely to discuss sensitive issues honestly when we create an emotionally safe situation. So use a calm tone of voice, respectful language, appropriate eye contact, non-judgmental responses, and just an emotional steadiness. Our clients are often going to test us so that they can feel safe before they fully disclose things. And so even subtle reactions like visible discomfort or shock are going to increase shame and reduce openness. So we need to focus our conversations on their health, their testing, their relationships, their emotional struggles. We're not minimizing the seriousness of the HIV-related concerns, but we are reducing the unnecessary fear and stigma so that clients can feel safe seeking support and health care. So ethical counseling requires self-awareness. We need to examine our own personal beliefs and our emotional reactions, our discomfort, our assumptions, our biases related to HIV and sexuality, addiction, and stigma. All professionals carry personal experiences and cultural conditioning that may influence interactions unconsciously. So the goal here is not perfection. The goal is awareness and professional responsibility. And when we can recognize our own reactions, we're better able to provide that client care. We need to make sure that we're using continuing education, supervision, consultation, and self-reflection. That's an important part of ethical professional development. So as we close this module, just remember that confidentiality and ethical professionalism are essential components of HIV-related counseling work. And our clients are going to carry significant fear around disclosure, rejection, stigma, and privacy concerns. And as counselors, we can help to create emotional safety through respectful communication, professionalism, ethical boundaries, and protection of client dignity. Reducing stigma and building trust is going to improve both the counseling relationships and the healthcare engagement. And in the next module, we're going to focus specifically on stigma, bias, and cultural humility in the behavioral health care setting and how the counselor attitudes can affect the client outcomes. So when you're ready, proceed to module 12.